HESI Nursing Practice Evaluation. Question 1. When teaching parents of a school-aged child with a new diagnosis of osteomyelitis of the tibia, which statement by the parents indicates an understanding of the teaching? My child will have a cast until healing is complete. My child will receive antibiotics for several weeks. My child can return to playing sports once he is discharged. My child needs to be in contact isolation. B. My child will receive antibiotics for several weeks. Correct answer. The correct answer is B. Osteomyelitis of the tibia typically requires antibiotic therapy for at least 4 weeks. Surgery may be necessary if the infection does not respond to antibiotics. Weight bearing should be avoided with osteomyelitis to prevent complications. Choices A, C, and D are incorrect because a cast until healing, returning to sports immediately, and contact isolation are not primary management strategies for osteomyelitis. Question 2. A nurse is auscultating the lungs of an adolescent who has asthma. The nurse should identify the sound as which of the following? Biot's respiration, Cheney-Stokes respiration, tachypnea, bradypnea. C. Tachypnea. Correct answer. In this scenario, the correct answer is C. Tachypnea. Tachypnea is an increased respiratory rate, which is commonly seen in patients with asthma during an acute exacerbation. This rapid breathing is a compensatory mechanism the body uses to try to improve oxygenation. Option A, Biot's respiration, is characterized by irregular breathing patterns with periods of apnea. This is not typically associated with asthma. Option B, Cheney-Stokes respiration, is a pattern of breathing characterized by alternating periods of deep, rapid breathing followed by periods of apnea. This is not a typical finding in asthma. Option D, bradypnea, is a decreased respiratory rate, which is not consistent with the presentation of a patient with asthma experiencing difficulty breathing. Educationally, understanding the different respiratory patterns and their significance is crucial for nurses caring for pediatric patients with respiratory conditions like asthma. Recognizing tachypnea in a patient with asthma can prompt appropriate interventions and timely management to improve outcomes. Question 3. A nurse in an emergency department is caring for a school-aged child who is experiencing an anaphylactic reaction. Which of the following is the priority action by the nurse? Elevate the head of the child's bed. Insert a large bore forecatheter for the child. Determine the allergen that caused the child's reaction. Administer IM epinephrine to the child. D. Administer IM epinephrine to the child. Correct answer. In the management of anaphylaxis, the priority action for the nurse is to administer IM epinephrine to the child. Epinephrine is the first-line treatment for anaphylaxis, as it helps reverse the severe manifestations of the reaction by constricting blood vessels, relaxing airway muscles, and decreasing hives and swelling. Elevating the head of the child's bed may be beneficial for respiratory distress, but is not the priority over administering epinephrine. Inserting a large bore forecatheter may be necessary for fluid resuscitation, but is not the initial priority. Identifying the allergen is important for prevention and future management, but is not the immediate action needed in the acute phase of an anaphylactic reaction. Question 4. The healthcare professional is preparing to administer an immunization to a 4-year-old child. Which of the following actions should the professional plan to take? Place the child in a prone position for the immunization. Request that the child's caregiver stay in the room during the immunization. Administer the immunization using a 24-gauge needle. Inject the immunization slowly without aspirating. C. Administer the immunization using a 24-gauge needle. Correct answer. When administering an immunization to a 4-year-old child, it is important to use a 24-gauge needle to minimize pain and discomfort for the child. Thicker needles can cause more pain and tissue trauma. Using a thinner needle like a 24-gauge is appropriate for pediatric immunizations. The other options are not recommended practices. Placing the child in a prone position is not ideal for immunization administration. It is beneficial to have the caregiver present for support. And aspirating before administering the immunization is not required for intramuscular injections in current practice. Question 5. A healthcare professional is reviewing the laboratory. Identify which of the following laboratory values indicates effectiveness of the current treatment. Potassium 2.9 milliequivalent/L, sodium 140 milliequivalent/L, urine-specific gravity 1.035, Bun 25 milligrams per deciliter. B. Sodium 140 milliequivalent/L. Correct answer. In pediatric nursing, monitoring laboratory values is crucial in assessing the effectiveness of treatment, especially in conditions like severe dehydration. In this case, the correct answer is B. Sodium 140 milliequivalent/L. Sodium levels are a key indicator of hydration status. In severe dehydration, sodium levels are typically elevated due to the concentration of sodium in relation to water loss. Therefore, a normal sodium level of 140 milliequivalent/L would indicate that the treatment is effective in restoring the infant's hydration status. Option A, potassium 2.9 milliequivalent/L, is low and can be a concern in dehydration, but it is not the best indicator of treatment effectiveness in this scenario. Option C, urine-specific gravity 1.035, reflects urine concentration and hydration status, but is not as direct or sensitive as serum sodium levels. Option D, BUN 25 milligrams per deciliter, can be elevated in dehydration, but is not as specific to hydration status as sodium levels. Educationally, understanding the rationale behind interpreting laboratory values in pediatric patients is essential for providing safe and effective care. By grasping the significance of each value in different clinical scenarios, nurses can make informed decisions and interventions to optimize patient outcomes. Question 6. The healthcare provider is providing teaching about social. Which of the following play activities should the provider recommend for the child? Playing pat cake, using a push-pull toy, creating a scrapbook, playing dress-up. D. Playing dress-up. Correct answer. In pediatric nursing, understanding child development stages is crucial for providing appropriate guidance to parents. In the case of a preschooler's social development, engaging in imaginative play like playing dress-up, option D, is highly beneficial. Dress-up play fosters creativity, social skills, and emotional expression in children by allowing them to role-play different characters and scenarios. This type of play helps preschoolers explore their identities, develop empathy, and practice social interactions. Regarding the other options, A. Playing pat cake. While this activity can be fun and promote coordination, it primarily focuses on physical development rather than social development. B. Using a push-pull toy. This type of play is more geared towards enhancing motor skills rather than social skills. C. Creating a scrapbook. While scrapbooking can be a creative activity, it may not directly target social development as effectively as imaginative play like dress-up does. Educationally, by recommending dress-up play for the preschooler, healthcare providers can empower parents to support their child's social development in a fun and engaging way, fostering important skills that will benefit the child's overall growth and well-being. Question 7. A newborn's parents are being taught about ways to prevent sudden infant death syndrome, SIDS. Which of the following instructions should be included? Place the infant in a prone position to sleep. Allow the infant to sleep on a large pillow. Use a soft mattress in the infant's crib. Give the infant a pacifier at bedtime. D. Give the infant a pacifier at bedtime. Correct answer. The correct instruction to prevent SIDS is to give the infant a pacifier at bedtime. The use of a pacifier while the infant is sleeping is associated with a decreased risk of SIDS. Other recommended preventive measures include placing the infant on their back to sleep, using a firm mattress in the crib, and avoiding soft bedding or pillows. Question 8. During an assessment, a healthcare professional is. Which of the following findings should be the priority for the healthcare professional to report to the provider? Nasal flaring, WBC count of 11,300, Diarrhea. Abdominal distension. A. Nasal flaring. Correct answer. When assessing an infant with pneumonia, the priority finding to report to the provider is nasal flaring. Nasal flaring indicates acute respiratory distress, which can be a life-threatening condition requiring immediate intervention. Monitoring and addressing respiratory distress take precedence over other symptoms or laboratory results in this situation. Question 9. A school nurse is assessing a school-age child's blood. Which of the following actions should the nurse take first? Clear the immediate area around the child of hazardous objects. Loosen the child's restrictive clothing. Assist the child to a side-lying position on the floor. Apply an oxygen mask to the child. C. Assist the child to a side-lying position on the floor. Correct answer. In this scenario, the correct action for the school nurse to take first when a school-age child experiences a tonic-clonic seizure while seated in a chair is to assist the child to a side-lying position on the floor, option C. This is because placing the child in a side-lying position helps prevent aspiration and ensures an open airway, reducing the risk of injury during the seizure. Option A, clear the immediate area around the child of hazardous objects, is important but not the first priority when a child is actively seizing, as the immediate safety and well-being of the child take precedence. Option B, loosen the child's restrictive clothing, may be helpful after the child is in a safe position, but it is not the priority during an ongoing seizure. Option D, apply an oxygen mask to the child, is not necessary during a seizure unless respiratory distress occurs after the seizure ends. Educationally, it is crucial for nurses to prioritize actions during emergency situations like seizures, ensuring the safety and well-being of the child. Understanding the correct sequence of interventions can prevent complications and promote optimal outcomes for pediatric patients. Question 10. A healthcare provider is preparing to administer ibuprofen 5 mg per kg every 6 hours PRN for temperatures above 38.0 degrees Celsius or 100.5 degrees Fahrenheit to an infant who weighs 17.6 pounds. The infant has a temperature of 38.4 degrees Celsius or 101.2 degrees Fahrenheit. Available is ibuprofen liquid 100 mg per 5 milliliters. How many milliliters should the healthcare provider administer to the infant? 12 milliliters, 6 milliliters, 2 milliliters, 1 milliliter. C. 2 milliliters, correct answer. To calculate the correct dosage, first convert the infant's weight to kilograms. 17.6 pounds equals 8 kilograms. The prescribed dose is 5 milligrams per kilogram, so for an 8 kilograms infant, the total dose required is 40 milligrams. Since the available ibuprofen liquid is 100 milligrams per 5 milliliters, to find out how many milliliters to administer, divide the total dose, 40 milligrams, by the concentration of the liquid, 100 milligrams per 5 milliliters, which equals 2 milliliters. Therefore, the healthcare provider should administer 2 milliliters of ibuprofen to the infant. Question 11. A toddler has minimal change nephrotic syndrome, MCNS, and 3+ pitting edema. Which intervention should the nurse include in the plan of care? Encourage an increased fluid intake for the toddler. Place the child in an airborne infection isolation room. Increase the toddler's dietary sodium intake. Administer corticosteroids to the toddler. D. Administer corticosteroids to the toddler, correct answer. In managing minimal change nephrotic syndrome, MCNS, in children with pitting edema, corticosteroids are the mainstay of treatment. Corticosteroids help reduce inflammation and decrease proteinuria, addressing the underlying cause of MCNS. Therefore, the nurse should prioritize administering the prescribed corticosteroids to the toddler as part of the plan of care. Question 12. A nurse is providing discharge teaching to the parent of a school-age child who has moderate persistent asthma. Which of the following instructions should the nurse include? You should give your child his salmeterol inhaler every 4 hours when he is having an acute episode of wheezing. You should monitor your child's weight weekly while he is receiving inhaled corticosteroid therapy. Pulmonary function tests will be performed every 12 to 24 months to evaluate how your child is responding to therapy. When using the peak expiratory flow meter, record your child's average of 3 readings. C. Pulmonary function tests will be performed every 12 to 24 months to evaluate how your child is responding to therapy. Correct answer. The nurse should inform the parent that the child will need pulmonary function tests every 12 to 24 months to assess lung function and response to treatment. These tests help evaluate the presence of lung disease, monitor disease progression, and assess the effectiveness of the current therapeutic regimen in managing asthma. Question 13. During a well-child visit, a nurse is assessing a 3-year-old toddler. Which of the following manifestations should the nurse report to the provider? Blood pressure 90/50ths, respiratory rate 45 per minute, weight 14.5 kilograms or 32 pounds, heart rate 110 per minute. B. Respiratory rate 45 per minute. Correct answer. In pediatric nursing, during a well-child visit, it is crucial for the nurse to accurately assess a toddler's vital signs to ensure proper growth and development. In this scenario, the correct answer is B. Respiratory rate 45 per minute. This is because a respiratory rate of 45 per minute in a 3-year-old toddler may indicate potential respiratory distress or an underlying health issue that requires immediate attention from the healthcare provider. Option A, blood pressure 90/50 is within normal range for a 3-year-old and does not typically warrant immediate reporting unless accompanied by other concerning symptoms. Option C, weight 14.5 kilograms or 32 pounds is also within the expected range for a 3-year-old child and does not raise immediate concerns unless there has been a significant weight change. Option D, heart rate 110 per minute is slightly elevated, but can still be considered within the normal range for a toddler at rest. Educationally, it is important for nurses to understand the significance of each vital sign in pediatric assessments, and when deviations from the norm may indicate a need for further evaluation. Regular training and practice in pediatric assessment skills can help nurses develop the proficiency needed to identify and report abnormal findings promptly to ensure the well-being of pediatric patients. Question 14. When preparing an adolescent for a lumbar puncture, which of the following actions should the nurse take? Place a cardiac monitor on the adolescent prior to the procedure. Apply topical analgesic cream to the site 1 hour prior to the procedure. Keep the adolescent in a semi-Fowler's position for 4 hours following the procedure. Restrict fluids for 2 hours following the procedure. B. Apply topical analgesic cream to the site 1 hour prior to the procedure. Correct answer. In preparing an adolescent for a lumbar puncture, the correct action for the nurse to take is to apply topical analgesic cream to the site 1 hour prior to the procedure. Option B. This is because the application of topical analgesic cream helps to numb the area, reducing the pain and discomfort the adolescent may experience during the procedure. It promotes a more comfortable experience and can help alleviate anxiety in the adolescent. Option A, placing a cardiac monitor on the adolescent prior to the procedure, is incorrect as a cardiac monitor is not typically required for a lumbar puncture in this context. Option C, keeping the adolescent in a semi-Fowler's position for 4 hours following the procedure, is also incorrect as maintaining a supine position is usually recommended to prevent complications post-procedure. Option D, restricting fluids for 2 hours following the procedure, is incorrect as maintaining hydration is important to prevent complications such as post-lumbar puncture headache. In an educational context, understanding the rationale behind each action is crucial for pediatric nurses to provide safe and effective care to their patients. Teaching the importance of proper preparation, including pain management strategies like applying topical analgesic cream, helps nurses optimize the patient experience and outcomes during procedures like lumbar punctures. Question 15. A healthcare professional is preparing to collect a sample. Which of the following actions should the healthcare professional plan to take? Obtain a sputum specimen. Perform an Allen test. Perform a finger stick. Obtain a stool specimen. C. Perform a finger stick. Correct answer. The healthcare professional should perform a finger stick on a toddler as a component of the sickle turbidity test. If the test is positive, hemoglobin electrophoresis is required to distinguish between children who have the genetic trait and children who have the disease. Finger stick is a common method used to collect blood samples, especially in pediatric patients, for various tests. Question 16. A school-age child has peripheral edema. Which of the following assessments should the nurse perform to confirm peripheral edema? Palpate the dorsum of the child's feet. Weigh the child daily using the same scale. Assess the child's skin turgor. Observe the child for periorbital swelling. A. Palpate the dorsum of the child's feet. Correct answer. To confirm peripheral edema in a child, the nurse should palpate the dorsum of the child's feet by pressing a fingertip against a bony prominence for 5 seconds. This assessment helps detect the presence of pitting edema, which is characterized by an indentation that remains after the pressure is released. Question 17. A toddler in the emergency department has partial thickness burns on his right arm. Which of the following actions should the nurse take? Insert a nasogastric tube. Initiate prophylactic antibiotic therapy. Cleanse the affected area with mild soap and water. Apply a topical corticosteroid to the affected area. C. Cleanse the affected area with mild soap and water. Correct answer. In pediatric nursing, it is crucial to provide appropriate care for burns to prevent infection and promote healing. The correct action in this scenario is to cleanse the affected area with mild soap and water. Option C. This is because cleaning the burn helps remove debris, bacteria, and dead tissue, which can reduce the risk of infection and promote proper healing. It is important to use mild soap to prevent further irritation to the sensitive skin of a toddler. Inserting a nasogastric tube, option A, is not indicated for a toddler with burns on the arm as it is not related to the immediate care of the burn injury. Initiation of prophylactic antibiotic therapy, option B, is not necessary at this point unless there are signs of infection. Applying a topical corticosteroid, option D, is also not recommended for partial thickness burns in the acute phase as it can impair wound healing and increase the risk of infection. In an educational context, understanding the appropriate management of burns in pediatric patients is essential for nurses caring for these vulnerable populations. Teaching the correct wound care techniques, such as cleansing with mild soap and water, ensures optimal outcomes for pediatric patients with burn injuries. This knowledge empowers nurses to provide safe and effective care in emergency situations involving burn injuries in toddlers. Question 18. A healthcare professional is performing hearing screenings. Which of the following children should the professional refer to a provider for a more extensive hearing evaluation? A toddler who is 18 months old and has unintelligible speech. An infant who is 3 months old and has an exaggerated startle response. A preschooler who is 4 years old and prefers playing with others rather than alone. An infant who is 8 months old and is not yet making babbling sounds. D. An infant who is 8 months old and is not yet making babbling sounds. Correct answer. The healthcare professional should refer an infant who is not making babbling sounds by the age of 7 months to a provider for a more extensive evaluation of hearing. Babbling sounds are a developmental milestone that typically occurs by 7 months of age. Delayed or absent babbling can indicate potential hearing issues that warrant further assessment. Question 19. A nurse is providing dietary teaching to the parent of a school-age child with cystic fibrosis. Which of the following statements should the nurse make? You should offer your child high-protein meals and snacks throughout the day. Your child should decrease dietary fats to less than 10% of their caloric intake. Your child will need to take a 1-gram sodium chloride tablet daily throughout their lifetime. You should calculate your child's carbohydrate needs based on their daily activities. A. You should offer your child high-protein meals and snacks throughout the day. Correct answer. The parent should provide a well-balanced diet that is high in protein and calories for a child with cystic fibrosis. This diet helps meet the child's increased energy requirements. Offering high-protein meals and snacks throughout the day is essential to ensure adequate nutrition and energy intake for children with cystic fibrosis. Question 20. The healthcare provider is providing dietary teaching to which of the following foods to the child? Wheat bread, vanilla malt, barley soup, rice pudding. D. Rice pudding. Correct answer. In the context of pediatrics nursing, it is crucial to provide accurate dietary education to parents of children with conditions like celiac disease. The correct answer, option D, rice pudding, is the most suitable choice for a school-age child with celiac disease because rice is a gluten-free grain safe for consumption by individuals with celiac disease. Rice pudding is a tasty and safe option that aligns with the dietary restrictions necessary for managing celiac disease. On the other hand, options A, B, and C are incorrect choices for a child with celiac disease. Option A, wheat bread contains gluten, which is harmful to individuals with celiac disease as it can trigger autoimmune responses damaging the intestines. Option B, vanilla malt often contains barley malt, which is also a gluten-containing ingredient not suitable for individuals with celiac disease. Option C, barley soup contains barley, another gluten-containing grain that should be avoided in the diet of someone with celiac disease. By understanding the importance of gluten-free diet in managing celiac disease, parents can make informed choices to promote their child's health and well-being. Education on appropriate food choices is essential in preventing complications and ensuring optimal growth and development in children with celiac disease. Question 21. When receiving change of shift report for children, which child should the nurse assess first? A toddler who has a concussion and an episode of forceful vomiting. An adolescent with infective endocarditis who reports having a headache. An adolescent who was placed into halo traction 1 hour ago and rates his pain at a 6 on a 0 to 10 scale. A school-age child with acute glomerulonephritis and brown-colored urine. A. A toddler who has a concussion and an episode of forceful vomiting. Correct answer. The nurse should assess the toddler with a concussion and an episode of forceful vomiting first when receiving change of shift report for children. Forceful vomiting in a toddler with a concussion indicates increased intracranial pressure, requiring immediate assessment and intervention to prevent further complications. Question 22. In caring for an adolescent with severe abdominal pain due to appendicitis, where should the nurse identify as McBurney's point? Right lower quadrant, left lower quadrant, right upper quadrant, left upper quadrant. A. Right lower quadrant. Correct answer. McBurney's point is located in the right lower quadrant of the abdomen, specifically between the umbilicus and the anterior iliac crest. This point is significant in diagnosing appendicitis, as tenderness at McBurney's point is a classic sign of appendicitis and indicates inflammation near the appendix. Question 23. When providing teaching to the family of a school-age child with juvenile idiopathic arthritis, which instruction should the nurse include? Limit the child's movement of the large joints. Encourage the child to perform independent self-care. Provide the child with a soft mattress for sleeping. Schedule a 2-hour daily nap for the child in the afternoon. B. Encourage the child to perform independent self-care. Correct answer. Encouraging the child to perform independent self-care is essential when managing juvenile idiopathic arthritis. This instruction helps minimize pain and stiffness in the child's joints while promoting mobility and independence. It is crucial for the child to learn self-management skills early to cope better with the condition in the long term. Question 24. A client has a new diagnosis of celiac disease. Which of the following clinical manifestations should the nurse expect? Steatorrhea, projectile vomiting, sunken abdomen, weight gain. A. Steatorrhea. Correct answer. Celiac disease is a condition where individuals are unable to digest gluten, leading to damage in the bowel cells and subsequent malabsorption. This malabsorption commonly presents with symptoms such as steatorrhea, which is characterized by foul-smelling, greasy, and bulky stools due to high fat content. Therefore, the nurse should expect steatorrhea as a clinical manifestation in clients with celiac disease. Question 25. When teaching an adolescent about managing tinea pedis, which statement indicates an understanding of the teaching? I should buy some plastic shoes to wear at the swimming pool. I should wear sandals as much as possible. I should place the permethrin cream between my toes twice daily. I should seal my non-washable shoes in plastic bags for a couple of weeks. B. I should wear sandals as much as possible. Correct answer. The correct answer is B. I should wear sandals as much as possible. This statement indicates an understanding of managing tinea pedis because wearing sandals promotes airflow, keeping the feet dry and preventing the fungus from thriving in moist conditions. Option A is incorrect because wearing plastic shoes at the swimming pool may trap moisture, exacerbating the fungal infection. Option C is incorrect as permethrin cream is typically used to treat scabies, not tinea pedis. Option D is incorrect as sealing non-washable shoes in plastic bags may create a damp environment, facilitating fungal growth. In an educational context, it is crucial to teach adolescents about proper foot hygiene, including keeping feet clean and dry, wearing breathable footwear like sandals, changing socks daily, and avoiding sharing shoes to prevent the spread of tinea pedis. Emphasizing these preventive measures can help adolescents effectively manage and reduce the recurrence of fungal infections.